Dr. Halstead, Doris, you're with me. Copy that. Barry?
Alex Mayer, 23 slash and stab, large diagonal laceration to the abdomen. He's a little tacky. GCS 15.
Get it out!
You're going back, Dad.
Get it out!
Wait, weapon still in him?
I don't know. Wasn't even a call. We were 2 blocks away, saw him on the street bleeding. Loaded him in the ambo and rolled.
I can feel it inside
Whoa,
me.
whoa, whoa. Alex, keep your hands down.
I got you, Dr. Halstead. Let's transfer.
On my count. 1, 2, 3. 2 of Versed to calm him down. Thank you, boys. How's that Versed coming?
On it, doctor.
Gaping diagonal incision in the right upper quad.
Evidence of evisceration?
No, I can see the base. Abdomen is still intact. Just a flesh wound. Really clean, though.
Wash it out and stitch it up.
Irrigation?
Sir, you're a lucky man. Whoever knifed you didn't do any serious damage.
Look at this. Betadine smeared all over the abdomen. The skin was prepped before the cut. I'm telling you, that incision is precise.
Back alley surgery gone wrong?
Alex, what happened?
I was desperate.
Dr. Halstead, his hand under the blood.
More betadine.
So he doused his own hands.
Alex, did you cut into yourself?
I had to get it out.
Get what out?
The person living inside me. Why don't you believe me? I'm not crazy. Something lives inside of me right here.
I hear you. I understand.
To get it out! I feel it all the time.
Alex, we're gonna help you. I promise. Sedative?
No, wait. I'm sorry. I'm telling you the truth. I can feel it inside me. Please. Please.
What'd you give him?
5 of Versed.
2 probably would have sufficed.
He put hands on you. I was being cautious.
So what are you thinking?
Schizophrenia.
You know, that was my initial thought, but now I'm not so sure.
Seriously? That's paranoia that there's something living inside him, and his attempt to remove it is literally a textbook definition of a somatic delusional disorder.
I'm stuck on the level of premeditation. You know, sterilization with betadine, the clean incision, doing it near a hospital. Well, that kind of forethought, it's just not consistent with schizophrenic psychosis.
So he's a germaphobe with a steady hand. It doesn't mean he's not schizophrenic.
Could be true, too.
So, start him on antipsychotics and reassess when his mind's clear?
I'm just not there yet. My gut tells me it's chemical, like maybe a methamphetamine overdose. Before we go any further, let's run a tox screen, see if he's just high.
Alex's tox screen is negative for methamphetamine, negative for all drugs. In fact, he's clean.
Yeah, I saw the report.
So now can we start him on a course of antipsychotics?
I'm just still not convinced it's schizophrenia.
How? He's presented with more than enough evidence of a thought disorder to warrant the diagnosis.
Yeah, even so before today, I mean, his medical record is clean. The history doesn't track with schizophrenia.
Or meth addiction. He doesn't fit the profile of a user either.
Yeah, just because he's clean today doesn't mean he's free of the drug.
So that's what the fan is for? White noise? Dr. Charles, really?
Yes, really. White noise has been proven to trigger auditory hallucinations in meth users.
How long have you been waiting for something to happen?
7 or 8 minutes,
How long does it usually take?
2 or 3. Probably not meth. Go ahead, start antipsychotics.
2 of Haldol. Dr. Charles?
Oh my God.
Alex, get his hand, get his hand!
I need a gun.
Come to your...
Help! I need some help in here!
No!
What happened?
He used a pen to pop the stitches, chisel through his abdominal wall.
Clearly.
All right, no time to repack. Got to scoop and move. Saline?
Okay, call OR. Tell them we're coming immediately.
How's he doing?
A few more feet to go, but no perforations to the bowel.
I was just standing there. Meanwhile, he's ripping himself open with a pen. The extra Versed completely tricked him out.
But if I hadn't given it to him, who knows? I mean, Alex was intent on harming himself. He could have attacked one of us.
What the hell? There's something embedded deep in his left gutter, next to the colon.
What is it?
I have no idea.
Wow. I guess there was something living inside of Alex.
Still not exactly sure what I'm looking at. Is it a tumor?
Possibly. Or it could be a fetus in fetu, a twin that he absorbed in utero. Either way, it's not a result of schizophrenia or meth.
How about that?
It's gotta be so rare.
To say the least. It's very cool.
How did he know not only that there was something inside him, but exactly where it was?
Beats me. I mean, after all the advances we made, splicing the genome, reprogramming viruses, mapping the brain, in this case, you know, just completely trumped by human instinct.
Everything I've learned about human nature, I still can't see things coming.
He scared you?
There's risk in our work.
I guess I realized a long time ago you choose to see the threat or the opportunity.
I'm fine. It's just a really bad cold. It's our first vacation together. Emergency room's not on the itinerary.
Temps 100.4.
Sienna, it's barely a fever.
God forbid he let on that he's sick.
I've got a stubborn one also.
Me too.
Lymph nodes are enlarged. All right. I'm gonna have you open your mouth for me.
He hasn't eaten in 3 days. Can barely sip water. Hurts that bad.
Throat is pretty raw. Tonsils are swollen. Yellow exudate.
What's that?
Pus. Maybe an infection.
See, we should have come yesterday.
I'll get a rapid strep test.
Let's get a CBC and BMP also.
I'm sorry. I just wanted the trip to be perfect.
And I just want you to be healthy.
Well, hopefully we can solve both of your problems. I'll be back shortly. Hi, guys. So Tommy, you do not have strep, but your body is most likely fighting off a bacterial infection. So I'm going to start you on clindamycin, which is an oral antibiotic.
Whatever the bug, it'll take care of it.
So we can get out of here?
Yes, but please just try to take it easy the next few days. As cliche as it is, rest is the best medicine.
I won't let him leave the hotel, promise.
Are you okay?
My ankle.
Why don't you let me take a look?
Whoa, that's really red.
You didn't feel anything?
Hot and fluctuant?
IND it.
Yeah. Now, I'm gonna make a small incision so that we can get a sample, okay? All right, and when I ask you to, I'm gonna have you take a deep breath and exhale for me, okay? All right, this is gonna hurt a little bit, all right? Take a deep breath in. Good. And another one. And again. Good. And one last time. Great job. All right, here comes the incision.
Oh,
Is that what was in my throat?
how did it get at his ankle?
Let's just wait and see what the lab says. Bad news, though. You guys are gonna have to hang out here a little bit longer. I'm sorry. All right. If you need anything, I'll be close by.
Bacteria can travel once it enters the bloodstream, but for a new infection to manifest that fast.
Yeah, something's definitely going on. Stay in the lab, okay?
Yeah.
Hannah. Hannah.
Oh my God. Tommy? Help! Help! What's happening?
Temps up to 104. He's tacky. He's 94/62. Septic shock.
First dose of egg didn't work. Bolus a liter of normal saline and push IV Tylenol. Tommy, can you open your mouth for me?
What are you looking for?
Abscesses that weren't there earlier. Nothing dental, oral. Help me search his skin.
Nothing on this side.
Here, Arthur. Get a cooling blanket. He should be getting better, but he's only getting worse. It's gonna be okay. It's okay.
Deja vu. Oh, I had pneumonia right after college. Spent 2 weeks in the hospital, Waukesha, Wisconsin.
Let me guess. Same vending machines?
It's amazing.
Cafeteria makes a great smoothie.
No, I want to stay close to Tommy. I'll find something.
Hey.
Hi. Tommy's latest labs. He doesn't have a staph infection. Vancomycin-resistant enterococcus.
A superbug?
Yeah, and one that is not easy to get. VRE is a nosocomial infection. It lives in hospitals. I don't think I've ever seen it contracted anywhere else.
Hannah. She had pneumonia a decade ago, was hospitalized for 2 weeks, could have picked it up then and had it ever since. Asymptomatic carrier.
Intimate relationship. Lots of ways she could have passed it on. Okay, let's start Tommy on IV linezolid, swab Hannah's nose and throat for the bacteria, confirm if she's the source.
Got it.
I got this from Hannah?
How? I don't have a sore throat, no fever, aches, pains. I'm not sick.
You don't have an active infection, but since your pneumonia, you've been contagious.
For 10 years? I work in an office, cross paths with dozens of people every day, not to mention boyfriends before Tommy. No one else has ever gotten sick.
We're gonna run some tests and find out exactly what it is.
Honey, I'm so sorry.
It's not your fault. You had no idea. Besides, I'm feeling better. It means that these antibiotics are working, right?
Yes.
Put Anna on them, kill whatever bug she's been dragging around the last 10 years.
I'm afraid it's not that simple. You see, as a carrier, you're colonized with the bacteria, which means it lives in too many places in your body for the antibiotic to be effective.
You mean I've got this forever?
I'm afraid so.
Then I could give it to Tommy again.
With precautions, the risk of reinfection can't be reduced.
This can't be happening.
We can deal with it. We'll figure it out.
He can't breathe!
Heart rate spiking, starting at 88%.
Get him on oxygen.
Got it.
My breath sounds diminished on the left. Give me the ultrasound.
Yes, doctor.
Hey, Tommy, why don't we wait outside, okay?
Left side's full of fluid. Let's give him 4 morphine and 2 of Versed. We need to get in a chest tube now. Lidocaine. Need the tube now.
Got it. Stats are coming up. He's stabilizing.
April, let's get a blood sample for cultures. And Doris, when you finish taping the tube in place, get that pus off the wall before environmental services has a fit.
Someone help my son! Somebody help my son!
He's having a seizure. April, push 2 of Ativan.
On it to a Ativan.
He's burning up. We need to get him upstairs for a head CT now.
Yes, doctor.
April, let's move.
Okay, here we go.
What is happening to my son?
Ma'am, I promise you, we're gonna find out.
Ryan has an infection in his brain.
It's called a subdural abscess. He contracted an infection, and as it spread, a small collection of pus was walled off inside his brain.
How does this happen?
We're hoping you might be able to help us answer that.
Mrs. Potter, can you think of anywhere Ryan may have been exposed to a fungus or parasite?
Did Ryan go camping? Possibly swimming in a lake or river?
No, nothing like that.
Any dental work?
We haven't been to the dentist in ages. Never. It's too expensive.
Severe tooth decay on the left posteriors. Small abrasion on the surface of the gums. Could have allowed bacteria to enter the bloodstream and travel to his brain.
Am I gonna be okay?
We'll start you on antibiotics, but you'll likely need surgery to drain the abscess.
I'll get you a referral for an oral surgeon.
How could this happen? He never even complained of a toothache.
Don't blame my mom. She didn't know. It was just a toothache. I shouldn't have kept it a secret.
Just a toothache. Can't imagine how much that hurt.
She's always worried about money. I didn't want to worry her more. It's my fault.
No. You did what you thought was best.
Paid from Dr. Choi.
He's in trauma 1.
I want it off!
That guy's crazy.
Ah! I want it off. Please, take it off.
Tell Ortho Henry coming up. Get a CBC ABG chem panel and type and cross him for 4.
Got it.
This is Mr. Tacker.
He was in a hardware store, grabbed a hatchet, tried to hack his arm off.
It's not me.
Medics gave him 1 milligram of Versed and 4 morphine in the ambo.
Mr. Tacker, I'm Dr. Charles. What's going on?
Can you cut it off?
I'm not a surgeon, but I'd like to try and help you.
The only way you can help me is if you cut off my arm.
How bad's the injury?
Cut through the radial artery, but I think we could save the arm.
No, please don't.
Mr. Tacker, I promise you we'll talk about this later, but right now our concern is your safety, so we got to get you up to surgery.
No, cut it off.
We'll talk later.
I want it off.
Any idea what that's about?
I definitely want to do a drug screen, but I think we might be dealing with something else.
Crazy. Poor guy.
It's still there.
Yeah. I guess they were able to save it.
Oh, God.
I'm sorry. It's important to us that you don't hurt yourself. Mr. Tacker, I'm a psychiatrist, and I'd very much like to help you, but I need to understand why you tried to sever your arm.
I told you. It's not mine. It's not part of me.
How long have you felt this way?
Since I was a little boy, 4 or 5. I'd look at it and it just felt strange, like it belonged to somebody else. It's like walking around with something dead on me.
Sounds terrible.
I talked to a doctor a couple months ago, asked him if he could remove it. He threw me out of his office, told me I was crazy. But I'm not crazy. I've been on the internet. There are others like me. I've tried to cope. I just can't stand it anymore.
Mr. Tacker, if it's any comfort, I'm going to do everything I can to help you.
Dr. Charles, what's the word on Mr. Tacker?
No physical issues that would make him want to self-amputate. Labs are clean, not on drugs.
Psychotic.
He is, in fact, entirely rational.
Rational people do not try to cut off their arms.
I think he might be suffering from a very rare condition, something I never dealt with before. BIID, Body Integrity Identity Disorder. Bear with me now. These people believe that one of their limbs, part of their body, is not their own. His sense of self does not extend to the fingers on his left arm. It stops at the elbow.
Sorry. Sounds a little out there to me.
I mean, who are any of us to say where we end, right? Or begin? I mean, physicists will tell you there's no physical self at all, right? Just waves of energy. A mystic? Say that we're all one big soup.
I'm not a physicist or a mystic. I'm a doc who spent his career treating wounded soldiers who begged me, save my leg, save my arm. You don't think you should commit this guy?
At this point, my only option is to put him on a 72-hour suicide hold, and then I gotta let him go home.
And then what? He'll try it again?
Unless I can find a way to treat him.
Blood pressure spikes.
Mr. Tacker?
I'm sorry.
He slipped his restraint.
He made a tourniquet out of tubing.
Half milligram dilaudid?
Yes, Dr. Charles.
No, don't touch it. The arm's dead. You dump potassium into the bloodstream, he'll go into cardiovascular collapse. We have to amputate his arm.
No.
Let's go.
No, I'm sorry. I had to.